Funny. Although you are the person that I'm like, oh, if I don't know some peds things, I'm like, Dr. Wolford will know.
I might know who to ask.
Isn't that like, that is really what we go to medical school for, right? Like, is knowing where to find the resource. Hello, everyone. It's great to be back with the Flint Community Webinar, your community resource every Friday at noon, a partnership between Michigan State University, the Healthy Flint Research Coordinating Center, and today we've got Genesee Health Systems with us. We're so excited to be back here today and bring you trusted information that you need to hear. Today, we've got a great panel of experts. We've got Jim Milanowski, President and CEO of Genesee Health Plan, here to talk a little bit about Medicare and open enrollment. Brenda Delgado is here, Office of Programs and Operations and Local Engagement for Medicare and Medicaid Services, is going to talk a little bit more about that. We've got some of our local community centers. We've got Tim McCarron here from Hamilton to talk a little bit about what you can expect in your primary care offices in terms of paying for your healthcare. Nurse T is going to tell us a little bit about what's out there in the community. We've got some people from Genesee Health Systems, Natasha Feinster, and we've also got one of my residents, Atar Ghanam. She's a second-year resident who's going to talk to us a little bit about RSV. So big, we're excited to get into it. Thank you so much. We're going to start off with a little bit of a reminder about RSV. The last few weeks, we've been talking a lot about what RSV is doing in the community, and Dr. Wolford has been so great to take us through pediatric RSV and what to expect. I'm excited to talk to Dr. Ghanam about what she's seeing in the ER or in the clinic in terms of patients presenting with RSV and what it's looking like.
Absolutely. Hi, everyone. Thank you for having me this afternoon. So RSV is a pretty common virus, and we know that it does usually start in the fall and it kind of peaks in winter. What's interesting about this year, and specifically in our Flint community, is this surge of numbers that we've seen. And I know that they've been having it, like you see it all over the news, and it seems a little scary. But they're actually not blowing it out of proportion for once. The numbers are a little bit concerning and definitely more than what we're used to. So like Dr. EJ said, I'm a resident. I work at McLaren. I have the fortune of working in the ED as well as in the outpatient setting. We also work in our program at the free clinic. We also do work at Hurley Hospital in the PEDS department. And then we work at the nursing home at Mission Point. So we got to see kind of how the RSV trends are throughout. And I got some numbers here from both the CDC and then the Genesee County Health Department. Yeah. It's pretty interesting. With regards to McLaren outpatient, they saw a 50% surge in patients coming in with respiratory symptoms. Now, that could definitely be, of course, regular cold. But of those 50%, the people that we had positive come back for RSV PCR was 16%. So that's significant. And this is general, like this is including adults.
Yeah.
Pre-clinic, 11% of the people that we sent out for RSV PCR, they're coming back positive. In the Hurley peds, and I know we have someone on from Hurley, and maybe they can speak more about this, but from what I understand, their peds ICU is at capacity, basically. They've had a surge of about 23%. With regards to our emergency department, they have ordered over 1,000 RSV tests just in this last month. So
Wow.
just in from October to November. And again, that could be being extra vigilant, but also it could be the vague kind of symptoms that we're getting. And this is, again, adults and children. For Mission Point, which is a geriatric population, we saw 14% of a surge. In our own ICU department, it is currently at an 89% capacity. And of those, over 60% have palm reasons for being in the ICU. And of those, 18% came back positive for RSV. So very different than I think previous years. So it's something to be watching. And I think it's important for us in the Genesee County to be aware.
Thank you so much for those numbers. I think those are really helpful, and it puts a lot of what we're seeing in context. One of the things I'd like to highlight is we've really talked about RSV as this pediatric disease, and we do know that for the most part, RSV is the worst in our pediatric population for all of the reasons that Dr. Wolford has described so well for us before, right? Kids have smaller airways, they have a little bit more difficulty sort of managing those secretions. But it's interesting because we're seeing this increase in RSV even in adults. And it sounds like even in our own McLaren ICU, we're seeing sort of more adults that are having complications related to RSV, where it typically results in common cold symptoms. Nurse T, would you say that's kind of consistent with what you're hearing in the community and what you're seeing out there?
Absolutely. I would say it's consistent across the board. RSV volume has increased, and I sit on some of the steering committees for the Michigan Hospital Associations, to where all of the hospital CEOs and everybody that's a representation of their medical center get to come on, and that was also a highlight of our conversation. But I would like to give some good news. Hurley have been extremely busy caring for patients with RSV. And yes, we were at capacity. But yesterday we were able to discharge and make more beds and be able to continue to provide care and services for our community. So with the help of the community, knowing the importance of discharge and being compliant with the medical treatment, you think about the admissions, but discharges are so important, because when we can discharge patients to a safe plan, or for when they get to go home, and then we can admit more. So I'm just so excited to say that, yes, we were able to accommodate our kids, and that we had discharges to be able to free up some beds in our PICU.
That's fantastic. Thank you so much for sharing that information. Nursey, what would you say because you're in the community and you're hearing from people and you get to hear what they're worried about, what would you say is the thing that comes up among people in the community with respect to their worries about RSV?
I think a lot of people, they hear about RSV and they know the concerns of it, but a lot of people are still thinking that it's a possibility that they may have COVID, because what we did notice as well, that we are at an all-time high volume for patients coming in for COVID testing. For the last 7 days, we've had actually 818 COVID tests. A couple of days ago, we did 167. So I think a lot of people, even though they know RSV is out in the community, they are still having concerns and fears, thinking that it may be COVID. But luckily, when they're coming in, they're testing negative for COVID, and we've seen an increase of flu-like symptoms. So
I'm so glad. Go ahead. I'm sorry.
No, I was just saying, I'm just excited about, because when you hear 818 in 7 days, and so I don't know whether the COVID testing sites around the community have decreased, but so that just goes to show us that a lot of the community residents are still tying everything with the fear of catching COVID.
I I appreciate you bringing up the point about COVID and the point about certain respiratory viruses, right? Because there is the flu, there is COVID, there is RSV, and Dr. Ghanem, we're seeing all three, right? I was just seeing patients earlier today, and we're certainly testing for all three, and we're seeing all three. And it's important, one, to make sure you have access to a primary care doctor so that instead of having to go to the ER in case your symptoms aren't super severe, that you can get in with your primary care doctor and get that testing, right? Because the symptoms are, go ahead.
I was going to say that you're absolutely right. When we test for all of them, right? Like we do a respiratory panel. So we'll do our RSV, we'll do our influenza A and B, and we'll do our COVID, and we'll include them. And what's interesting is people that you think would not have RSV, like our adult population, like our geriatric population, they're the ones coming positive, like coming back positive for RSV. But we've, like I think Nurse T was saying, we've actually seen a decrease in COVID, which is great.
That is fantastic.
Yeah.
And some of this we would expect, right? We're coming back from a Thanksgiving holiday. People were around their family members and colleagues. And so it's expected that we would see sort of an increase in various respiratory viruses. And I see Dr. Gordon putting in the chat saying, can we explain why adults are having an increase in RSV? And largely because we've seen such an increase in the pediatric population, it makes sense that we would see more sort of virus in our adults. And it's not so much that adults don't get RSV, it's just that adults don't get really severe symptoms for RSV. And sort of with this natural increase or this increase that we've seen in our pediatric population, it makes a lot of sense that we would see sort of a subsequent or a later increase in RSV in adults. And of those adults who are likely to have like chronic conditions or more maybe have underlying lung disease, that some of those are going to struggle with RSV and need some extra help in our ICU or in the ER or in the hospital.
Yeah.
So
and as well as with seniors, the seniors are real compromised as well when it comes to RSV, because a lot of them have a compromised immune system. And if they have any underlying medical conditions, especially heart disease or any of those underlying medical conditions, they are more susceptible. You know, I would encourage everybody, even as far as with RSV, just think about it as a respiratory infection that everybody is at risk for, and that we got to continue to put in safe measures. You know, washing our hands, wearing our masks if we feel ill, not going places if you're sick, but paying attention to any changes, especially fatigue. What I'm hearing a lot now in the community is fatigue and aches. They're having a lot of body aches. I know at one time the determining factor was temperature, but now everybody is starting out with body aches and a slight headache.
Okay. That is very helpful to know, and it's really helpful information for the community. I really appreciate both of you and your expertise and taking some time to talk to our community about what's going on in the community with RSV and what we can expect. I think as we think about sort of some last points that we should tell the community to think about, I think, you know, staying hydrated, taking care of your chronic conditions, making sure you're vaccinated against the flu and COVID so that it can decrease your risk severity for those, and then getting in with your primary care doctor when you do have symptoms. And, you know, I'm a little biased because I am primary care. I love my specialist.
Oh, I think Dr. EJ is frozen. So if either one of you have any last kind of words, any advice that you want to share, that would be fabulous.
I really love Dr. EJ's comments about the other things that are coming in and impacting COVID. That are coming in and impacting the fact that all three. Okay, are we good? All three are present at the same time: the COVID, RSV, flu. So do the things that you can do. You can get a vaccine for the flu. You can get a vaccine for COVID. Anybody 6 months or older. So let's do those things so that we can at least not get that. And then we can't do much about the RSV except saying, washing our hands, wearing a mask, staying socially distanced. And many people think that one of the reasons why RSV is so much worse this year, in part might be because we're somewhat weakened by having had COVID beforehand. So try to do the things that you can do to protect yourself from all of these that we have discussed many, many times. I'm not sure if Dr. EJ is back on, but I hope I said the things that she would have wanted said.
I think you did. She is not back on, but we're going to keep this train going. And you always provide such wonderful information. So thank you to everyone. We're going to transition to our next speakers and keep this going, but don't go anywhere, you guys, because we're going to bring you back at the end to talk about what you're seeing in our seniors and other folks. Next, I'd like to bring in Jim Milanowski. You guys have seen Jim before. He's been on the webinar a bunch of different times talking about everything going on with the Genesee Health Plan, but he brought an additional resource for us, and that is Brenda Delgado from CMS. So we're going to turn things over to Jim and Brenda to start us off on this conversation around open enrollment and Medicare.
Wonderful. Thank you, Heatherland. And I'm following smart people, and I had to bring a smart person like Brenda on. So I'm kind of in between here. So if you could just pull up my PowerPoint, I just have a very short one. But it is open enrollment time. It's that time of year. And so there's a number of different enrollments taking place. The one that's one of the bigger ones is healthcare.gov marketplace. Open enrollment is now through January 15th. So this is what we used to call Obamacare, or still do, some of us. And what's nice, and I think Brenda will talk about this when she discusses this, is that there's been some changes in the law. And I know I've been on this webinar to discuss that. And we used to always joke that the Affordable Care Act wasn't so affordable for a lot of people. Well, there are affordable options now for many people that would qualify. And so, and we're seeing those. So there could be some savings of $50 per person per month, or $85 per policy per month. And so we certainly, and then I know Tim's on a little bit later, there are organizations out there that can help people enroll. And so healthcare is not real easy. There's so many options. And so you can certainly call our office and the number is there, or you can call Hamilton or whoever. But that open enrollment is through January 15th. Next slide, please. So for new people that are enrolling for the first time on that exchange, due to those COVID relief laws, they might have signed up for this years ago. The Affordable Care Act's been around since 2016, and they might have dropped coverage at that time because they just couldn't find a plan that worked for them or was too expensive. Well, now 4 out of 5 enrollees may get a plan for about $10 a month. So it's changed since 5-6 years ago. And so there are opportunities for people to get a good health plan at a price that they can afford. And that includes doctor visits. We heard about how important primary care and preventative care is, and also cared for these respiratory type of illnesses. And so that's what these insurance companies cover. Next slide, please. So for people that have already enrolled every year, and we're going to talk about some of those other types of coverages, you have to go and re-enroll. And so again, they can certainly keep their current plan or select a new one. It's that time of year where they can do that through January. And again, people are seeing a coverages that are cheaper by as much as $50 per person. So I would strongly encourage people who are currently have a plan to go in and do their homework, or to, again, have one of the staff that can help them with this, help them apply and see how much of a savings that they can receive. Next slide, please. So, who are the uninsured? We've done a great job in our community with all these partners of signing people up for healthcare coverage, but there's still what we call seasonal or gig workers. Those are musicians, daycare workers, bus drivers, salon workers, pet groomers, restaurant servers that don't qualify for healthcare coverage through their employer. They might not work full-time, or they might not work enough hours. They might work 2 or 3 part-time jobs. They're not covered by their spouse's insurance. They're usually a employee of a small business. So again, these are the folks that, if you're having a conversation with them, we can all be active in outreach for enrollment and ask them, do they have healthcare coverage? Because there really is no reason why anybody in our community in Genesee County that should not have healthcare insurance. There are so many options out there, and we strongly encourage people to go for them. Next slide, please. So again, sometimes we say, oh, there's lots of savings out there, and yeah, you're like, right, I've heard that story before, but actually we're seeing it even during this open enroll plan and time period. One of our staff reported that they was able to find a bronze plan. There's different kinds of plans on that exchange with a high deductible but no monthly premium. She was able to see her PCP and specialist without meeting her deductible. She will save $116 monthly on the premium and $63 on prescriptions. So those are the things that we're hearing. And so again, strongly encourage people to give it a try or to sign up if they haven't done so. Next slide, please. So we are very fortunate, and our next speaker is from the Centers for Medicare and Medicaid Services, and Genesee Health Plan is able to receive a federal grant through them to help people enroll into healthcare coverage, not only here in Genesee County, but you might know people in Saginaw and Bay counties, and we also assist people in those communities during this open enrollment period. So we're very grateful for the support it pays for our staff and have enough staff on hand to be able to provide healthcare enrollment. Next slide, please. And so one of the things that we did and partnered with not only ourselves, but with the Greater Flint Health Coalition, Hamilton, and Valley Area Agency on Aging, it was a phone bank that we had a few weeks ago, and people were able to call in, and it was televised on WNEM Channel 5. And people were able to call and ask questions about Medicare, Medicaid enrollment, healthcare.gov enrollment, because again, there's so many questions out there. And so we had over 130 calls during that time period on November 16th. And just a reminder, and I'm sure Brenda and some of the other speakers will speak on this, Medicare open enrollment runs through December 7th. So you have a little bit tighter of a window. So I had mentioned healthcare.gov enrollment through January 15th. This is through December 7th, so next Wednesday. So seniors have been kind of bombarded over the last few months with Medicare enrollment, and there's a lot of TV, a lot of mail that people get. If someone is happy with their Medicare plan, they don't have to do anything. They're just automatically re-enrolled. But if they want to make any changes, they can do that, but they have to do that before December 7th. So there's still some time, but we're kind of heading in the home stretch on that. And so the other speakers will speak on this, but again, Genesee Health Plan is here to help. I know VAAA or Valley Area Agency on Aging has staff that will assist. So please get in touch with us, give us a call, and we'll be able to help those seniors, especially who have Medicare, to get enrolled into healthcare. Next slide, please. So this was just some pictures of some of the staff from the different agencies. You can see Tim, who's speaking in just a minute, was answering phones. So again, a great event. And so we're very appreciative of our partners that help us with this. Next slide. And so again, and we try to do as much media on this as we can. And you'll see Brenda, who's going to be speaking in just a minute, came on a Facebook Live, very similar to this, and just talking about these different things to try to educate. And then VAAA, also Yashika, who does a great job there, was also. So it's really the partnership of trying to get every single person enrolled into healthcare in our community. Next slide, please. So you can see, and I'm just going to quickly go over these and get to the other speakers, that since 2014 with healthcare.gov, you see that it really climbed in the first couple of years. A lot of people signed up. It kind of went down a little bit, but now we're seeing an uptick. Now that those savings are there, we're seeing a lot more people nationwide. This is a nationwide slide, enrolling over 14 million, almost close to 15 million people enrolled into the marketplace. And then the next slide shows Michigan. Yeah, and you can see that it kind of dipped initially from the initial interest, but now we're coming back. And again, I think that's because of the savings that are available. So we'll have to see where this enrollment period ends. But you can see that in the state of Michigan, we're probably at about 300,000. In Genesee County, there's probably an estimate of between 10 and 15,000 people who are on healthcare.gov. Next slide, please. And so again, I think I saw that in the chat. Please contact us if you have any questions, but I'm going to turn it over back to you, Heatherland, and to our other speaker, Brenda.
All right, perfect. Thanks, Jim. And we are so excited to have Brenda join us from CMS. Brenda, take it away.
Thanks so much, guys. So I'm Brenda Delgado, and I work for the federal agency that runs the Medicare program. Also, we work with the states on the Medicaid program, and then we also run the health insurance marketplace, which some people used to know it by its common name from a few years ago, Obamacare. And this is really so critical that we get this message out. As Jim said, we've been trying to continue the drumbeat as many ways as possible. We did the Facebook Live. They had organized the phone bank. This is another opportunity for us to get the word out. And the reason why it's so important to get the word out is there's deadlines coming up that are really around the corner for enrollment. There isn't, for most people, year-long enrollment. You have to take action, and we only have a few weeks left for the marketplace, and we only have a few days left for people who are on Medicare. So who exactly are we talking about? Well, for the marketplace, it's really any age, any income who just needs health insurance. It doesn't matter if it's a newborn or a 99-year-old. It doesn't matter what income level they are. If they need health insurance, they can go to healthcare.gov. They put in their information. There's even, you can use it on your cell phone and do it in just a few minutes. And it depends on what area you live. So you put in your address and your zip code. And then there's these tax credits, which is what Jim was talking about, is a way to reduce the cost in paying for your healthcare coverage. So even though they're tax credits, you don't have to wait to file your taxes to get the savings. What we want to make it easy for people is we give them to you ahead of time. So they're called advanced tax credits. And you immediately see the savings in the premiums that you pay for a health insurance marketplace plan. And what we've seen this year, 4 out of 5 people are finding that they enroll in a plan for less than $10 or less a month. Like, this is health insurance that covers your emergency room, your surgeries, your prescriptions, your doctor visits, your vaccinations, your therapies, your mental health care, which is even more important now than ever. We are still in a teen mental health crisis that we've been seeing even since before COVID started. So having access to behavioral health care, mental health therapists, regardless of age, but especially for young people, is so important. And part of that access is making sure that you have health insurance. So if you need health insurance, we're asking you to go to healthcare.gov. We're asking you to share this information, not just because we have such a robust number of speakers today on today's webinar, but the people who we are reaching through the webinar, the people you work with, the people who live on your block, the people you go to church with, the people you hang out with. Someone in there, for a variety of reasons, does not have health insurance. They could be an entrepreneur. A lot of people changed jobs and went into business for themselves during pandemic. And now they have their own wonderful business, but they need to buy their own health insurance. Maybe people are in between jobs. Maybe their job doesn't offer coverage. Maybe their job only offers coverage for the worker and does not offer coverage for their family. Maybe they are finding that it was used to be unaffordable to find healthcare coverage. And what we also want to emphasize is there were a couple series of laws, but most importantly is those laws increased recently the amount of assistance for the marketplace plans. That's why 4 out of 5 people can find a plan for less than $10 a month. That's why people are being able to find a plan where even though they have a high deductible, they can go see their primary care doctor, they can go get their wellness visits, all of their preventive care, all of their vaccinations. They can get that for free or very low cost without meeting their deductible. So a lot of this assistance is available, but people need to know they have to take action. We have a couple weeks left. There's one deadline I want to emphasize. It's the December 15 deadline to enroll in a marketplace plan if you want to get coverage by January 1st. Even though enrollment in the marketplace is going to go all the way to January 15 of next year, if you enroll on December 16, that means you missed that December 15 for your coverage to start January 1st. And if you enroll December 16, anytime up to January 15, your coverage won't start until February 1st. Now, if you had other health insurance, that's fine. It will just float over until your new marketplace plan would be effective February 1st. But if you really do not have health insurance right now, it is so critical to engage with either healthcare.gov or a navigator at Genesee Health Plan to help you find the best plan for you, because we never know when we're going to get sick. The people who are walking through the emergency room did not go in there with an appointment. They showed up unexpectedly, something happens, either you fell on a curb or you got the flu or you had some other complication and you find yourself in a health crisis and you go to the emergency room to get good care. You want to have health insurance to help pay for those costs and make sure that you're covered. So the December 15 deadline at healthcare.gov, or call Genesee Health Plan, speak to someone in person, over the phone, someone who's local, understands what hospitals are part of what plans. The assistance is there. Secondly, I want to also remind people who are on Medicare. Medicare is for people who are over age 65. So we're talking about our seniors. And as Jim said, you're seeing all these commercials on the TV, and I can guarantee you if you have elder loved one in your family and you go over, you're going to see the stack of mailing materials that they're getting. The marketing is intense. It's because health plans are competing for their business. They want them to enroll in their Medicare HMO or their Medicare PPO, and they know that they only have a few more days to catch their attention. If you know someone who's on Medicare who's over age 65, please share the information of people who are willing to help them, who don't have a vested interest in which plan they pick. They just want them to be in a plan that is best for them. So what makes a plan best for somebody? It saves them the most money. It takes care of all of their prescriptions that they're taking. Even right now, there's a new benefit for people who are diabetic that if they're taking insulin, they can get coverage for their insulin at a maximum copay of $35 a month. The only criteria is there's many types of insulin. So if a senior is on Medicare and they're diabetic and they're on insulin, let's save them some money and make sure that they have access to the $35 maximum copay. But whatever drug plan they pick, whatever health plan they pick, has to have ideally the insulin that that senior is on the list of insulins that that plan is going to cover, because there's many types of insulin. So it doesn't help somebody if the plan is offering $35 insulin of insulin A, B, C, and D, and that senior is on another type of insulin that's not on the list. So those are the kind of matches that we're trying to make. Find a health plan that works for them, saves them the most money, covers all of their prescriptions, and they only have a few days. For people on Medicare, if they're seniors over age 65, they only have until December 7 to use the Medicare enrollment period. So they can call 1-800-Medicare. They can go on medicare.gov. We really try to keep our resources as simple as possible. It's not hard to remember. 1-800-Medicare, medicare.gov, if you're on Medicare and you're over age 65. With that, this really is really timely information. So thanks for giving us a few minutes to share. And if anyone has other additional questions, we'll have some time to chat.
Thank you so much. This is so important and really, really valuable information, as you just described. And I appreciate you giving that phone number, because one of the comments from Nurse T in the chat is she's in the community with some seniors at a senior center who are listening. And she asked the question, what do you do? What do you do if you don't have access to the internet? As apparently I'm right. And so using that number 1-800-Medicare seems to be like the best resource for those who may not have access to the internet and still want to find out more details.
Yes,
Absolutely.
So they can call us, Dr. Johnson at Genesee Health Plan, and talk to someone here locally. So, but again, time is kind of running out. So I would suggest that they do that soon.
And 1-800-Medicare is 24 hours a day. If they want to call at 2 in-the-morning, someone's going to answer their phone, and it's available in 200 plus languages. So it doesn't matter if they speak English, Spanish, Hindi, it doesn't matter. There's someone who can answer their phone call in their language at 1-800-Medicare.
We appreciate you so much bringing this really valuable and needed information to the community. And I know Nurse T really appreciates it with the being out in the community and being able to connect people with these resources. So thank you. Now that we've talked a little bit about how we get access to insurance and how we might think about the resources we need to pay for our healthcare, I want to talk a little bit to some of our community centers that provide medical care. So I know we've got Hamilton here with us. We've got Tim McCarran. And I know you were going to talk to us a little bit about some of the resources that you have at Hamilton and what you see in your community in terms of what people need, what people come in with. Can you talk to us a little bit about that?
Yeah, absolutely. Thank you guys so much for having me. One of the things is that, kind of almost mirroring what a lot of what Jim said, is that we do have staff that can help people with both Medicaid, Medicare, as well as the marketplace, and of course the Genesee Health Plan. Something that Brenda said that kind of stuck out with me was her example of people within that diabetic group or program in finding their insulin. One of the, I think the best things that we can do for people for both marketplace and Medicare is that if they do have a specific prescription or even a specific provider that they see, even if it's just a specialist that they see, we can put that in and it will kind of tell us what plans cover those prescriptions or providers, and give us a pretty accurate estimate of what their copayment would be, so what their out-of-pocket would be. And so it helps people that are looking at several plans try to narrow down what would be best for them. And so, she mentioned that at least there is a cap on insulin for the marketplace people where they won't have to pay over 35. But to be able to give them almost down to the cent what they would pay at their local pharmacy, it seems to help people a lot in deciding, which to go with. And then what I find is people are a little nervous at first to make that commitment to paying that premium every month or whatnot. But that is kind of a reason why open enrollment is here. So we can always make changes every single year around the same time. But also there's a lot of special enrollment period reasons that would give people an opportunity to change in the middle of the year outside of open enrollment. Usually they have about 60 days to report whatever change it might be, whether they get married or divorced or have a child or move. So there's quite a few things that can give people more opportunities that they might not be aware of. And then locally here at Hamilton, we actually just hired another outreach and enrollment staff. So we're expanding a little bit there. And I'm going to put in the chat, there's a link at the top where people can go and make an appointment directly for somebody to talk with them one-on-one for enrollment purposes. We also help with like food assistance, cash assistance, emergency situations with like consumers and stuff like that. If they need that, they can certainly we can help them with that too. One thing that I find is a lot of patients don't necessarily have access to a computer and sometimes even just internet access. And even though a lot of things are available on our phones now, sometimes it just doesn't quite show up right on our phones, right? So sometimes it's just helping people upload a document or access their account or something like that very, very quickly. So we can help with those things. The enrollment hotline number is on there as well in the chat. And then just some of our walk-in times. So these are going to go through open enrollment for the marketplace. So January 15th, every Monday from 8:30 to noon in the morning, we'll be at our Burton Clinic over on South Saginaw. And then Tuesdays, our North Point Clinic is in Flint. It's on Clio Road between Pearson and Carpenter. We're going to be there in the afternoons on Tuesdays, and then in the afternoons on Wednesdays at our Clio Clinic out on Vienna Road. So even though that's just for open enrollment, we handle a lot over the phone now since COVID began, and I think it's so much more efficient. But if somebody wants that kind of old school one-on-one meeting in person, it does help a lot more when you have choices to make, like those that are looking at Marketplace or Medicare. So we can make those at any time. For us, we normally just ask what clinic they're closest to and what day and time works for them, and we'll just make a one-on-one appointment. So those are available throughout the whole year. Those that qualify for Medicaid, of course, they can sign up at any time throughout the year, just like Jim and Brenda mentioned. And people sometimes they'll have questions after they say they pick a plan. I think it's important for people to know that you're not necessarily stuck in a situation. So certainly while open enrollment is open, you have the opportunity to make changes all the way up until the end. Once you're past that, there are still some opportunities that people can take advantage of, such as even if you already picked a plan and now we're past open enrollment, if there's something that you're just not quite very happy with that particular plan, a lot of times the company that offers it will allow you to switch plans within the same company. So say you're with Molina, and maybe there's something that isn't covered that you weren't quite aware of, or that maybe the copayment or coinsurance is a little higher than you were expecting. A lot of times they do have an opportunity where you can switch internally with Molina to a separate plan. And that's just one company for an example, but most of them allow that. So I just always encourage people to ask the questions, because even if you think the answer is no, sometimes there might be a resource that one of us knows just because we've been doing this for so long. And usually if we don't know, there's like a whole network of us that we can kind of ask each other and get together and figure it out, which the Genesee Health Plan is amazing at. Honestly, I call them all the time and probably bother them, but you know, I think working together is key. And Nurse T and I were together in an event just yesterday, and something to that effect was said from Michigan United. There's so many people to serve, and it just makes sense for us to work together, and it just works better. So, coming together, I think we can really minimize any gaps that there might be within not just health insurance, but some of the other community resources. So I just encourage people to reach out to whatever agency you're familiar with and ask the question. And usually, even if they don't handle that specifically, they can get you to the right person.
Tim, you've talked a lot about how amazing the resources are that you provide in the context of our earlier discussion about Medicare enrollment and open enrollment. I wonder if you would talk a little bit about some of the services that you provide in your clinics and
Sure.
what people will often come into Hamilton for.
Yeah, absolutely. So I don't know if a lot of our patients realize that we have a lot more services than you might think of as far as Hamilton, because we've been around for about 40 years, and it has grown a lot from the small clinic that it was over on Hamilton Avenue. So for one, like one of my coworkers, we have a homeless program, and they help people not just with our sliding scale fee, but also with housing, with a lot of different resources that you might need if you find yourself in a homeless situation. For instance, if you do claim as homeless, then just a regular physical is completely waived. There's no co-payment to it. And I feel like a lot of people in that situation are avoiding getting health care, seeking health assistance because of their financial situation.
Absolutely.
And there's so many, social determinants of health and everything that might be keeping somebody from coming in. But we work on a sliding scale fee. So even if you don't have any insurance at all, or if you decide, not to pick up insurance, we can still base your payment on your family size and income. And often, most patients would still get a discount. It even helps for people that find themselves in that donut hole with Medicare. So technically, you don't really have insurance in that time frame, in that donut hole. That's something that we can apply the slide to, and then at least you get a usually a pretty good sized discount to kind of help you through that time until you're out of the donut hole. And it works that way with other things too. Say you even get a marketplace plan, but you decline the additional dental insurance. The slide would work at our dental clinic, just because if you don't have dental, even if you have other insurance, medical insurance, we can apply the slide and get a discount for you there. We have grown a lot as far as services that even if we don't provide, we partnered with U of M a lot recently in the last few years here, where we have a great vision program that can get people free or low cost glasses through a glaucoma study. You don't have to have glaucoma. It's just a screening that you'll go through, and then at the end you get the glasses, and they actually have a pretty wide selection that you can choose from. We also partner with U of M on a breast and cervical cancer clinic for women, which has been widely embraced because up until then, there wasn't really that many resources here in Flint, so they'd have to like drive out to, U of M and or another location to get that. And I think we all know here that transportation can be a huge barrier with
Absolutely.
patients.
Absolutely.
We
You've got a
picked-
question in the chat, Tim.
Oh.
Someone said, can a person living outside the county call local resources here for help, or do they need to go to their own county?
So we can usually help people no matter where they're at in Michigan. So you can either utilize that find local help on either the marketplace, healthcare.gov, or just call, one of these places like Hamilton or Genesee Health Plan. It usually is not really location specific. There's kind of a caveat to that with Medicaid, because usually if you get, say coverage in Genesee County, it tends to be specific to that one county. But say that there's some kind of procedure that isn't available here, and maybe you do have to drive out to Lansing or somewhere. In those instances, they do make it available so that you can get that procedure covered because it's not available in your area.
It's not available in the local
Yeah.
area. Makes sense. I want to ask Natasha, I know with your work with Genesee Health Systems, maybe you can tell us a little bit about similar resources, or, if someone's outside the county, what are you guys doing to help people access resources?
So in terms of Genesee Community Health Center, so we are the federally qualified health center. So we are the co-applicant of Genesee Health System. And so basically our total mission is to improve the health and health equity in Genesee County through the provision of high quality healthcare services and programs in an integrated patient-centered environment, and with a priority focus on the homeless and public housing residents. So ours is within the Genesee community realm. And so the services are, we provide services to everyone regardless of their ability to pay, mirroring what Tim said in terms of our sliding fee scale. We definitely, accept those insurances and, the uninsured and the underinsured. Sometimes there are specialty services that are asked in some of the insurances that may be out of network with some of our services. And so it may be potentially hard to coordinate that type of care if they're out of network with our plans. But as a federally qualified health center, we are considered like a safety net for the provider and the community. So we provide the high quality integrated care to everyone. And that includes both the insured, the underinsured, and the uninsured. And so as part of those requirements, we provide like preventative care, medication assisted treatment, behavioral health, the mild to moderate population, psychiatric care. We provide the chronic care management, on-site lab services, drug and alcohol use treatment. And we also partner with local resources to provide additional auxiliary services like our lab services, screenings for mammography, colonoscopy, dental services, and radiology. And those partners also, kind of like we partner with Hurley as well, they have a sliding fee scale that allow for those charges to accommodate their ability to pay. In many cases, those services are at no cost. And so we also have an on-site health navigator that can assist in coordinating those auxiliary services, specialty appointments, and other needs that anyone may have. We also have a partnership. I know Tim mentioned the barrier in terms of transportation. We also have a partnership with mass transportation in terms of being able to provide patients with transportation with Rise to Wellness to and from some of their appointments with our health center. And so we're able to kind of take that barrier off of those patients and not just offer just bus passes as well. As part of the holistic part that we offer support to those also that need food, housing, and utility assistance. Sometimes those patients come in that do not have insurance. We have on-site health coaches that we also have. We have a separate room where our health coaches would take the patients into a room where they would call and get patients set up for health insurance if they don't have health insurance and don't know how, if they, have trouble understanding some of the language and things like that.
Absolutely.
So they are on site and they are able to, at that moment, bring that patient into the room and set them up with insurance. Again, we are utilizing our resources within the community, linking and coordinating wraparound supports and meeting the people where they are. One of the biggest concerns at the ending of the public health emergency declaration and people losing their Medicaid medical coverage. Once Medicaid starts their recertifications, many lose coverage based on eligibility criteria. And so, as you all know now, that during the public health emergency, Medicaid has not denied coverage to anyone that meets that criteria at any time during the pandemic.
That's a wealth of information that you just provided. Thank you so very much for providing all of those details. I want to hone in before I get to Nurse T to bring her on with all of you so we can talk together about what we're seeing in the community for a few minutes. Can you talk for a few seconds about what specialty care means? Like, when you talk about specialty care, we've talked a lot about primary care, but what do you mean by specialty care?
So if they need like the immediate need in terms of just that medical care that they're in the office for, but
Sure.
if they need a referral for something that's a specialty care in terms of an off-site service that
Like
they're
a
not in
cardiologist.
network. Exactly. So that's not in network with our, that we can actually coordinate, then that just becomes a restriction.
Fantastic. So even everyone who's listening, you've got Genesee Community Health Center and you've got Hamilton here. We're going to provide resources to get you connected with your primary care services, but not just that. If you need to see a specialist, your rheumatologist, a pulmonologist, a cardiologist, an endocrine doctor, they've all got resources here to help you think about what that looks like too. So thank you so much. Don't leave. I want to keep you here while Nurse T is here to talk to us a little bit about what she's hearing in the community around senior concerns and access to care.
Okay. So some of the concerns with the seniors was just understanding the new changes with Medicare. So I know Dan Kildee came to Hasselring, I think in November. So what we did was we just created an information sheet. So when he was talking about what Medicare A covered versus Medicare B, what Part B covered, that the seniors would have that information in hand. And then they was a little bit unclear about insulin because they didn't know the rate that they was going to be charged. But we did find out that it was $35. So, and they were concerned about some out-of-pocket costs. So right now I'm currently sitting with probably about 10 seniors. And they are very tuned in and listening. Do you guys have any questions or concerns to report, or did I hit it all?
You hit it, but I do have one question.
Okay.
So,
Thank you.
I'm on the market. I have a marketplace plan right now. And I keep getting all these phone calls and emails about, check your plan. And so I want to make sure, do I have to go back onto the marketplace to be able to keep my plan going, or do I just need to look at it to review it to see if there's maybe something else that fits me better?
You don't have to go back and do anything to keep the plan that you currently have. The only instance where you might is sometimes if a plan is discontinued, then they'll send you a letter directly letting you know that one won't be available for next year. It's always kind of a good idea to just take a look though and review just to see and make sure a lot of times they will change their prices, whether it's the monthly premium or the, the co-payments and co-insurances. So it's not a bad idea, especially just to review it with somebody.
I plan to review it, but I just, they had me a little unsure on if I had to do that or not.
Mhm.
So thank you.
I did want
for
to add,
asking.
for the new tax credits that are even more generous than they were before. You really would just need to open your application and submit it back again. And that recalculates how much savings you would have. Otherwise, you would still get the savings, but you would get them when you actually file your taxes next year and reconcile how much assistance you are qualifying for. So because those new tax savings are pretty generous, you need to just open up your application. It'll re-trigger a recalculation. Even if you didn't have a change in income, the tax credits are more generous now. And you may see that your premiums are even lower now than they were last year.
That would be great.
That would be
Thank you for
great.
that. Awesome information. Thank you so much.
Thank you so much. For all of the experts that are here, we've got about 2 minutes left. Any last words of advice for Nurse T and her seniors that are out there wanting some assurance that they're going to be okay before this deadline?
Questions that you're afraid to ask.
I would say if they're seniors, just call 1-800-Medicare with any question. The experts there are phenomenal and they're there 24 hours a day.
Thank you so much. Any other last comments?
I was going to say all this information is, excellent, because this will also help in the community, like all the different resources. Because one of the biggest things is like the ER getting overpopulated because people don't know about the resources of going to like primary care, like the Genesee County Health Plan or Genesee Community Health or with Tim, because the copay, working in the ER for years, a lot of people will come in with things they could have routinely been seen at their primary care or urgent care, but they say they couldn't afford the copay. So by having all these resources in the community, that will also, help, decrease the burden on the ER. And like Nurse T, we're out there navigating, teaching people how to advocate for themselves and navigate through the healthcare system. And thanks, Tim, that is true. Join together. We were there at that meeting, join together all the resources, as partners. That's the community is the main concern. Thank you.
Thank you so much, Dr. Gordon. Thank you to all of the experts here today. I really appreciate all of the expert advice, and the community really appreciates the work that you do. Join us again next week. And a reminder to access your CHWs for social workers. This is all the information you need to be able to get your CE units. We'll see you next week.
Awesome job, you
Thank you so much,
guys.
Heatherline.
It was amazing. Oh, these webinars, you just never know what it's going to throw at you, but this was really good. And I love Nurse T getting to answer the questions live.
That was amazing.
That's phenomenal, just phenomenal. And all the information was so important and so timely, considering the deadlines. That was just fabulous.
Nurse T, the next time, let us, I'll save you like a good 10-15 minutes if I know